It's Wisconsin Today. I'm Rob Farrett.
And I'm Kate Archer-Kent. A measles outbreak in Texas has public health officials worried about a bigger resurgence of one of the world's most contagious diseases.
And Wisconsin may be vulnerable. According to state health data, Wisconsin has the second lowest measles vaccination rate for children nationwide.
Just ahead, we'll check in with a county health official in northern Wisconsin about measles vaccination rates there and local challenges. First, we take a look at why measles is back in circulation and how misinformation and vaccine hesitancy are contributing to the spread. Malia Jones is a public health researcher and assistant professor in the Department of Community and Environmental Sociology at UW-Madison. Malia, welcome to Wisconsin Today.
Thank you for having me.
Measles was declared eliminated from the U.S. in 2000, according to the CDC, but there have been measles outbreaks over the quarter century, and now most recently the death of a child in Texas. Why is there alarm in the public health community?
Yeah, we are seeing these increasing numbers of outbreaks. We did achieve elimination status back, as you say, in 2000, but over the decades since then, we've seen more and more outbreaks happening, and it's still considered eliminated, but when we see these increasing numbers of outbreaks and an increasing size of outbreaks, we do really worry that measles is on its way back, and we could lose our elimination status. And the main reason for that, as you suggest, is because of dropping vaccination rates.
How serious is the measles? What are some of the possible health complications?
It is very serious. The vast majority of kids who get measles get a rash and miss some school. But in more serious cases, and they're not all that uncommon, kids can also get pneumonia. You can get encephalitis leading to brain damage or even death. Blindness and deafness used to be really common, much more common than they are today as a result of measles infection. And the one that I worry about the most as an infectious disease epidemiologist is it's actually pretty common for when you have a measles infection for a couple of years afterwards, the kid's immune system is suppressed. And so they're much more vulnerable to all the other stuff that is going around. And so you actually see elevated rates of death from all infectious causes after a measles outbreak.
Why? Why are measles survivors more vulnerable to all of these other diseases for years after?
Yeah, we're just starting to explore the why of that question. What we know is that measles attacks the immune memory cells. And so if you have had some other infectious disease and have some sort of immunity built up to it, measles infection will wipe that out. And so you become vulnerable again to diseases that you got some immunity to previously. So we could see increased deaths from, for example, flu or other common infectious diseases that kids get all the time as a result of a lot of kids getting measles.
And even a vaccination rate that may sound high, like an 80%, 85%, leaves communities vulnerable to an outbreak. Why is that?
Yes. Measles, we need really, really high vaccine coverage in order to protect a community from a measles outbreak. And the reason is that it is the most infectious disease on Earth. Nearly everyone who is exposed to measles and has not been vaccinated will get it. So there's something called the reproductive number for measles. It's about 12 to 18. That means for every infection, it can spread to 12 to 18 more people who are unvaccinated. And if you think about a school setting or some other kind of congregation of kids together, it's very easy to get 12 or 18 kids in a room. And if a lot of them are unvaccinated, you're really going to see very rapid spread. So for measles, we need something like 95 to 98% of all people to be vaccinated in order to protect us from an outbreak. And we're well below that in many, many settings now.
How does that compare to COVID in terms of the spread?
It's much more contagious than COVID. It also spreads. It's an airborne transmission, and so COVID-19 spreads through small sort of droplets that fly through the air, and occasionally can become aerosolized and hang out in the air for a little while. But measles, it spreads through the actual air, so a kid can become infected just by entering a hallway that an infected kid has recently been in. It can remain infectious in the air for hours afterwards. And so it really does spread very easily.
I want to return to what you said a moment ago about vaccine hesitancy and anti-vaccine sentiment. It is an issue in this country. What is the impact of false narratives?
Yeah, for measles in particular, there was this incident that happened many years ago. A doctor named Andrew Wakefield published a small study showing a link between measles vaccine and autism. And a couple of years after that, it was revealed that he fabricated the data for that study. It was completely invented. But once that idea was out there in the stratosphere, it's really hard to get rid of. And so the rumor is still going around that measles vaccine can lead to autism. That is not true. And in fact, there aren't a ton of things that I would come on live radio and say, we know for sure that measles vaccine does not cause autism. But this has been studied very thoroughly. And so this is one that we really are very confident.
Fast forward to today, U.S. Secretary of Health and Human Services Robert F. Kennedy Jr. has downplayed the seriousness of the Texas outbreak. And let's listen to that moment at a White House cabinet meeting last week.
It's not unusual. We have measles outbreaks every year.
But then yesterday, Kennedy authors an opinion piece on the Fox News site saying he is deeply concerned about the recent measles outbreak. Malia, from your perspective in public health, what do you make of this switch in his level of concern?
Yeah, I think that I was happy to see yesterday's opinion piece showing some more support for vaccination, but he really did stop short of saying that vaccination is necessary and safe. I don't see it as a reversal so much as he's probably under a lot of pressure to acknowledge the facts here. And in fact, in that opinion piece yesterday, he said that vaccination is a family's decision to make and that we should focus on treatment. And then he named a treatment that has not been proven and neglected to mention that there is no treatment for measles. So I was not really satisfied by yesterday's opinion piece, although I think it was a little step in the right direction towards encouraging families to get vaccinated in this current context.
Malia, thank you for joining us.
Yeah, thanks for having me.
That was Malia Jones, public health researcher and assistant professor in the Department of Community and Environmental Sociology at UW-Madison. We've been talking about a growing measles outbreak in Texas and the risks here in Wisconsin. And now to a county in northern Wisconsin that has seen a sharp decline in measles vaccination rates. Melissa Geach is health officer for the Iron County Health Department. Melissa, welcome to Wisconsin Today.
Good morning. Thank you for having me.
Data from the state health department shows that Iron County saw a 20% drop in the percentage of 2-year-olds with the measles shot between 2013 and 2023. Why are fewer parents getting their babies vaccinated for measles?
There are a few reasons why vaccines are declining. As Malia discussed, misinformation and concerns about possible side effects have made some parents hesitant, especially with this mixed messages about the safety of vaccines. However, there's also access. A big challenge is families in rural areas may have to travel long distance or they struggle to get timely appointments. Competing priorities like food insecurity, job loss, unstable housing, and lack of paid time off can make it difficult for parents to prioritize vaccines. And for some, measles just doesn't feel like an urgent threat because they've never seen a case firsthand.
And you're in a much more rural area, far northern Wisconsin. Is, as you mentioned, transportation, that could be a barrier to getting to a pediatric appointment.
Yeah, in Iron County, we do have 2 small clinics that provide immunizations to residents. However, some may choose to travel up to 60 minutes to see a pediatrician, whether that's west to Ashland or south to the Minocqua or Woodruff area.
Melissa, what kind of vaccine outreach efforts do you have at the county level?
We're working on a combination of education, outreach, and those access improvements to increase immunization rates. But there's really no one size that fits all solution because we, people have different challenges. So One of our solutions is that our health department is a vaccine for children provider, and we offer free vaccines for eligible children. And if parents have challenges making appointments with the clinic, we coordinate with those local clinics and help parents schedule those timely appointments. We've also found that phone calls and reminder letters help keep kids on schedule. And then our schools do play a key role in linking families to us for accurate vaccine guidance and assistance.
Do you see older kids catching up and getting the vaccine when they reach school age?
I do. In Wisconsin, when they reach school age, Wisconsin requires certain immunizations for school entry. However, we're seeing some rising exemption rates, meaning not all kids are choosing to get, or parents are not choosing to get their kids vaccinated. And this does create the gaps in immunization rates and puts our kids at risk for for disease and making outbreaks more likely, which, can ultimately lead to school disruptions.
Melissa, in our final moments together, are you concerned about a possible measles outbreak in Iron County?
Well, in our small community, a measles outbreak could be difficult, as it would be an all hands on deck effort with our small staff here, and I think it would be a challenge. However, we have a close knit community and people really come together. So when contact tracing and people are really looking out for their community, so they do find themselves isolating and making sure that they're safe.
Yeah. Melissa, thank you for joining us.
Thank you.
Melissa Geach is health officer for Iron County Health Department in northern Wisconsin. Earlier, we spoke with UW-Madison public health researcher Malia Jones. We've been learning about a measles outbreak sweeping across Texas and how Wisconsin could be impacted by this highly contagious virus with a low vaccination rate for children.
Coming up on Wisconsin Today, chatbot programs are just one part of the field of artificial intelligence. Two Wisconsin researchers look at the practical applications and how students are getting hands-on training.
It's really important that we not only give our students the theory behind it, but how am I going to use it?
Wisconsin explores the future of artificial intelligence. That's ahead here on WPR News. It's Wisconsin Today. I'm Rob Farrett.
And I'm Kate Archer-Kent. Last month, a Chinese startup stunned the world by releasing an advanced artificial intelligence model. It was created at much lower costs than other models. DeepSeek also made its software open source, letting anyone download the software to fine-tune it.
DeepSeek shook up the artificial intelligence world and the stock market. It's just part of a flood of developments in the field.
AI research and education is going on here in Wisconsin. We reached out to two experts for their take and for a look at the work they're doing with their students.
Kang-wook Lee is an assistant professor in electrical and computer engineering at UW-Madison. Kang-wook, welcome to Wisconsin Today.
Thanks, Rob. Thanks for inviting me.
Let's start out by talking about a kind of artificial intelligence that I think most people might have interacted with, the chat bot, that where you enter a question or prompt and it gives you an output, some kind of text, things like that. People watching the news may have seen this information about DeepSeek, this Chinese program. It really rocked the world, the artificial intelligence world, and the stock market. What is unique or what was important about DeepSeek?
OpenAI, as their ChatGPT and their other models, they have been the most popular models out there around the world, and especially like the new model that they recently released, O1, O3. Those are called reasoning models that are kind of advanced version of the traditional ChatGPT models, and there has been no other competing reasoning models in the market. And we were expecting to see some other competing reasoning models to come out sometime soon, but we didn't expect it to come from China. I would say that was the most important reason why people are surprised.
Now, people listening, some of them may have used some kind of chat program, maybe to generate an outline for a work document or a school document or something like that. For people who haven't gotten there yet, what do you see happening in the next few years where this might become more and more commonly used? What are the uses that people who don't care about AI right now might be seeing in the next few years?
I'm a heavy AI user. It's been like few years like this, but it's getting more and more common in my daily lives. For instance, I find the current models out there, both ChatGPT models and also DeepSeek models, they're good enough to write a decent quality report. So whenever I want to learn something new, I ask the model to, hey, write a report on this. I want to learn about it. Then all these models out there, the frontier models are good enough to write a very decent model report on whatever I request. And it comes up with this good report in a few minutes. So that's something that I usually takes about a week if I ask my students, if I ask someone to do for me. So it saves a lot of time for me. And I think this is something that everyone can start using it right now.
People worry they may have seen in the news examples of reports like that getting things wrong. How much should we worry that that report we generated that we're learning from is giving us legit material?
It still is a problem. It's not fully solved, but the amount of fake information, made up information, which we call hallucination, is decreasing fast. So that's one thing. So I think in a few years, we'll have a much better solution that makes those kind of made up information with much less frequency. And also the newer models, they all have references coming up with these claims. So each claim is accompanied with a link. So you can click the link and see whether that information or the statement given in the report is correct or not. So eventually the final judgment and takeaway should be made by the human readers. So I guess as long as you spend some time to verify what is written in the report, that should be not a big problem.
And Kangwook, one of the reasons that we wanted to talk to you, it caught our eye. You developed and teach a class on the ethics of how we collect the information that goes into artificial intelligence. What kind of questions are you exploring with your students?
I mostly consider three issues in my class. I want the models, AI models, to be unbiased in a sense that it does not replicate the bias and stereotypes we all used to have in the past. We still have some of them in the real world. But if we just literally feed all the internet data and let the models see all of them without any filtering or whatsoever, the AI model will start replicating the same bias and stereotypes. So that's one thing I care about, having the model that's behaving differently from what we used to do, but we want the model to be more unbiased, more fair, and so forth. The other thing is I want the models to respect the privacy of the data. So the model might have seen a lot of private information, sensitive information on the training data set. And technically speaking, the models can memorize all the information from training. And at test time, at generation time, the chat might be able to reveal some of the private information that they have seen, but they are not supposed to talk about. So making sure that the models do not memorize everything private in the training data set, that is also important. That's the privacy issue. The last one is about robustness/safety. We want these models to perform something good for us, but we don't want these models to perform something bad. But there are many ways to get around the safety layers we have, and these models are still vulnerable to attacks where people with bad intentions may choose to use these AI models to do something bad. Let's say use these AI models to create chemical weapons or something like that. That's not what we want to see anytime soon.
Now, you are working with future engineers here in your classes at UW-Madison. How important is an understanding of AI technology for those jobs your students might be looking at in the future?
Well, I think it will be probably more impactful than what the internet and computer did several decades ago in terms of how it will change the society and the world we are living in.
More impactful than the internet, you're saying. The internet's been pretty impactful.
Yeah, that's true. But the internet was more about connecting stuff. It didn't make something completely new from scratch, I wouldn't say so. But this one is basically replacing the cognitive functions of what humans were only able to do in the past. So I'm expecting more impact than the internet.
Wow. Kangwook, thank you so much for sharing your work with us today.
Thank you so much, Rob.
Kangwook Lee is an assistant professor in electrical and computer engineering at UW-Madison. Now let's bring in Rahul Gomes, associate professor of computer science at UW-Eau Claire. He is working with AI and healthcare with his students. Rahul, welcome to Wisconsin Today.
Yep, nice to be here.
I want to dive right into the work you are doing with your students at UW-Eau Claire using artificial intelligence to work with healthcare professionals at the Mayo Clinic. Talk a little bit about what you've been working on.
Our collaboration with Mayo Clinic at this point has a bunch of projects, but one of them is trying to look at patient data. Take an example of colonoscopy. So colonoscopy generates a lot of reports, and then patients might get multiple versions of these reports. So one of the clinicians came up and says, "Hey, is there a way we can go through these reports and create a much more simpler model, and also create a summary of the report?" Now, what that summary will do is, it's going to tell, okay, did the person have any polyps? And if so, when should we schedule, the next meeting? So this would also make it easier for patients, when they're looking at their health chart, they can see that health chart and find out, oh, this is really important, rather than going through the entire report. And it also helps clinicians because, clinicians spend a lot of time going through these reports. And if you're trying to look at 4 or 5 reports down the line, it also makes things a lot more, slow. So our students came up and took the responsibility of creating this LLM, a large language model, with the clinicians. So I'm mentoring the students on how to do the computer science aspect of it. The clinicians are mentoring the students as to what these reports should look like and be compatible. It's exciting because you see the students who are just hearing about large language models, but then now they are implementing something. And some students were very excited because when they are creating these models, they get the feeling that this has practical implications, right? So health implications where patients' diagnosis might be faster, where patients will benefit, rural healthcare will benefit. So they were pretty excited to dive right in. So that's one of the examples, but we have several of these, AI and machine learning collaborations that we are doing with Mayo Clinic to advance patient healthcare.
When you're saying you and your students are developing models, are they doing a subset of that, taking lots and lots of colonoscopy reports, for example, and turning that into its own sort of chatbot in effect?
With healthcare data, we want to make sure that we are protecting the privacy of everybody, right?
Mm-hmm.
So that's important. And then also with large language models that are out there, which people mostly hear, they are very generic models, like they are designed to do day-to-day stuff, right? But we wanted to make sure that our models are reliable. They are safe. They are reliable. One of the primary ethics of AI. So that is why they are not only building the model to make it safe and reliable, they are also trying to reduce the model, make it much more reasonable, and we call that term in computer science as knowledge distillation, where instead of using a giant model, okay, we have a smaller problem, let's make it expert in this smaller problem. So they're learning how to use or interact with a model, and then also take that model and make it much more smaller so that I can manage it, and students can manage it, and even it will be easier for the clinicians to manage the models. So that's one of our goals here.
And Rahul, people might think, wait a minute, is a large language model going to be my doctor now? If I'm hearing you correctly, clinicians are still involved in this. The large language model might give summaries of the data, but they can look into it and they can dig into that original stuff if they wanted to still.
Absolutely. I mean, the goal right here is that let's have that deeper insight, but at the same point of time, let's also have a summary, right? It's not replacing. We can never replace doctors. I mean, even if we think years down the line, I mean, healthcare is really, there's no room for error, right? So we are really concerned about patients, but there are ways we can make them more effective, make diagnosis more effective. So it's kind of like there were tools in computer science, or any kind of think of calculators, for example. We still do math, but it helps us in a way to. I mean, they don't replace math. We still do math ourselves, right? So using that analogy is kind of like makes sense. We want to give more information, I mean, to patients as well as to the clinicians, but it's their call, right? It's more, a summary is more than what actually is happening for the patient, right? So there are lots of things happening. So they will actually go through all the reports, but we also want to have this convenience out there.
You've started to touch on this a little, Raul. Why is it so important to you to have your students there at UW-Eau Claire really involved, hands-on in a project like this?
It's really important that we not only give our students the theory behind it, but the students also realize, okay, today I took a class called CS426, Deep Learning, but how am I going to use it? Because that is a very basic question that everybody has. When they, get their hands into these models and see how they kind of, make a difference in the real world, it also motivates them that, okay, I learned how to use convolution neural networks as a type of an AI model. This is how it's applied in the real world. This is how I can make a difference. So that kind of, is really helpful for the students.
We're talking to Rahul Gomes at UW-Eau Claire, Associate Professor of Computer Science, about artificial intelligence, how he is working with students to apply it in healthcare settings and elsewhere. Part of why we called a couple Wisconsin AI experts now was the news of the release of this DeepSeek program by a Chinese company. Now, it's in that other category we've been talking about, those more general AI programs. The notion is, hey, it's doing a lot of these things quicker and cheaper. What do you think? What are your thoughts on this DeepSeek program that, at least for a day, blew up the stock market here in the United States?
Again, going back a little bit to the history, is that around 2010, for example, we became pretty good at classifying images. So if I give you an image, give a machine learning model an image of a dog, then it will be able to detect, oh, that's a dog, right? So images became pretty good, but we were still struggling with text because we couldn't parallelize the process of text. So is it going to rain today in Eau Claire, or is it going to rain today at Madison, right? So in order to predict the next word, we had to know the previous word. So it was a sequence of steps. But around 2017, transformers came out, and transformers showed us that you could parallelize this process. And the moment we realized we could parallelize this process, whoa, so we can use lots and lots of GPU. One of the optimizations DeepSeek came up with is how it trains. So it does use things like mixture of experts, knowledge distillation, mathematical computations, and chain of thought. But those are like big terms. But the basic idea is that it figured out how we can speed up the process, speed up the algorithmic thinking process. It also figured out how we can reduce the amount of training data that is required to get a response. It used things like reinforcement learning to do these. So it kind of accelerated the process of algorithmic optimization. I mean, these are different stages of evolution of any kind of computational algorithms, right? First we created, it works, that's good. Now, okay, can we make it better? So this is where we think, at least I think, that AI will try to become better in terms of optimization.
As we wrap up, Rahul, what are you watching for next? What potential next application has you the most interested?
Oh, I don't know. I mean, there's a huge implication here. We want to make sure that we make AI which is reliable. We want to make sure that we make an AI which is safe. We want to make sure that the AI can be is explainable. I mean, we know that it's a. I mean, most of us have this kind of idea that AI is I mean, large language models, any chatbots, they're black box, right? We can't see what's happening there. So the research now is how do we make this more explainable, right? So we want to be a part of to understand how this model is making predictions. So that kind of excites me. That is one factor that I'm really interested to dig deeper. Um, but the implications are huge. I mean, we can go with optimizing these models, or we can use these models in our daily life. We can run them locally now with variants of DeepSeek, and then also Meta has Llama models that you can also run locally in your system. So there's a lot of implications that you can use AI to make your life more convenient, but do it with safely and reliably. That would be my suggestion.
We'll leave it there, Rahul. Thanks again for joining us today.
Thank you.
Rahul Gomes is an associate professor of computer science at UW-Eau Claire. He joined us for a look at AI projects he's working on with his students. Earlier, we heard from Kangwook Lee, assistant professor in electrical and computer engineering at UW-Madison. Do you use some form of artificial intelligence program, chatbot or otherwise, in your work, in your education? What do you do with it? What's the experience been like? Do you still have a lot of open questions about what it's doing and how it works? Tell us about it. Email wisconsintoday@wpr.org. That's wisconsintoday@wpr.org.
Coming up on Wisconsin Today, New Glarus hosts the World Euchre Championship this spring. Check out the event and the local love for the card game.
It is a game that's really widely played here. So you could go to any of the local establishments and you could definitely find people who would be willing to sit down and help you learn the game.
It's Euchre coming up next on WPR News.
It's Wisconsin Today. I'm Rob Farrett.
And I'm Kate Archer-Kent. Euchre players from across the country will gather in New Glarus this spring for the third annual World Euchre Championship.
The event draws hundreds of players to South Central Wisconsin to compete for prizes in the card game played in living rooms across the state.
It's organized by the New Glarus Cares Community Foundation to support local community projects and boost business and tourism.
We're learning more about how the event comes together and what Euchre means for people in Wisconsin. Shelley Johnson is president of the New Glarus Cares Community Foundation. Shelley, welcome to Wisconsin Today.
Thank you for having me.
I was looking at some pictures of the championship. It looks like a lively event. Can you paint us a picture of what's going on when the tournament is up and running?
It is. It's a very lively event, and the atmosphere is just great. So we hold it at the New Glarus Fest House, and we've really grown the tournament over the last 3 years. So we continue to grow and expand and fill the Fest House. But people that are coming, from really not just the local area, but really from across the country and even Canada, are really coming for that full experience, to be there with other players and to just enjoy their time together and enjoy playing the game.
What is the origin story of the World Euchre Championship happening in New Glarus?
So it's really kind of interesting, actually. One of our board members came up with the idea as a fundraiser for our organization when we formed back in 2022. So May of 23 was the first time that we held the tournament. And really, we had kind of gotten feedback that, unless the tournament were sanctioned by someone, we couldn't really call it the World Euchre Championship. So we set up the World Euchre Federation. We have a constitution and bylaws. You can become a member of the World Euchre Federation. And so when we did it, we really did it to help fund projects for Nuclear Cares Community Foundation. And it's really just grown from there. It really started with, kind of what I'll call a shtick, right? Like a marketing shtick. But people love it and have really embraced it. And so, we're just continuing on down that path.
How many people end up participating in it now?
So our first year we had 176 players. So we had 44 tables and we just hosted a doubles tournament. Last year we added a singles tournament and we also grew the number of tables for the doubles tournament to 60 tables. So we had like a total of 480 players last year. This year we're doing a singles tournament and we've split the doubles tournament out into 2 preliminary sessions and then a championship session. And so we'll have a total of 624 players participating in the event this year, assuming, of course, we sell all the seats. But I have no doubt that we will sell out. We're already at 80% of our seats sold, and the event's still, more than 2 months away.
Yeah, and we're talking to you a little early because we didn't want to wait and have everything be sold out. And if listeners wanted to do stuff, it would be too late. People could sign up to participate. I believe you can be a spectator. And are you looking for volunteers as well?
Absolutely. Absolutely. It's kind of interesting that we really don't have a lot of local New Glarus residents who participate or play in the tournament. But yet we rely on that pool of people to help us run the tournament so that we can deliver a great experience to our visitors.
How far away are people coming to be part of the tournament?
You wouldn't believe. It's crazy. It really is. But we've got people signed up to participate from California, from Washington State, Texas, and even some from Canada. So, I would say that we looked at the statistics actually, and over 40% of the people attending the tournament this year that are registered so far are from outside the state of Wisconsin.
Wow.
And over 50%, even those that live in the state of Wisconsin, over 50% are traveling more than 100 miles to come here and play in the tournament.
So it's getting bigger each year. I mean, are you noticing like a local economic impact when you're starting to bring people in from that wider range?
Absolutely. Absolutely. We are really trying to help promote all of the other local businesses as well. And so, when we send out our newsletter to people who have either registered for the tournament or are members of the World Euchre Federation, we really talk to them about what's going on in town, what are other things that they can do while they're here, encouraging them to come to town early and spend time. There's really, New Glarus is a bit of a festival town anyway. And so we do have a lot of opportunities that you probably wouldn't otherwise expect from a small rural town in Wisconsin.
I want to talk about the level of competition here because I think of euchre the way it's been in my life. It's been a pretty friendly game with family members or with friends. Are people pretty serious about the competitive part of this at the tournament?
I would say it really varies. Some people, of course, are very competitive. And, it's just the nature of that individual. Some people are just very competitive, but we really have players from all skill levels. Some of them, are much more new to the game and are just playing for the fun, the companionship and camaraderie of it. But others are, yes, very serious about the game. But people coming in also know that, this is also a charity event. So it's not like a high stakes game from the perspective of they're not playing for money. They're playing for prizes and recognition. We have a great championship belt that the winners receive, and that belt is really coveted by people that play in the tournament.
And you've got some swag, too, I see that people can buy. And I shared this with our team here, and we've all been there if we've played euchre, a T-shirt that says, "My back hurts from carrying my euchre partner."
Yes,
Meaning I'm doing
exactly.
all the work here and they're just along for the ride. Can you talk about who's developing these fun slogans and swag for the Euchre event?
So it really is a combination. So this year, well, actually, let me take a step back. In 2024, we received some sponsorship from Bicycle Cards. And so now in for 2025, they are our official event sponsor. So the championship belts I mentioned will be provided for by Bicycle Cards. And in addition to that, they're providing swag. It will be their logo along with ours on the t-shirts for the events that all participants are getting along with their registration. So we've been really fortunate to partner up with them. And that kind of just opens up additional opportunities for us from a marketing perspective. So we have ideas that have come from them and some assistance that's come from them, certainly. But then one of our board members and actually a couple of other individuals that are originally from the New Glarus area but no longer live here, that have graphic arts background, have been helping us with these different designs that are available not just at the tournament, but we have an online shop. If they go to our website, worldyucrefederation.com, they're able to actually see and order those shirts and other merchandise on that website.
We're talking about the upcoming World Euchre Championships in New Glarus. We're talking to organizer Shelley Johnson, president of the New Glarus Cares Community Foundation. As you mentioned earlier, Shelley, the starting point here was raising money to do good stuff around New Glarus. Can you talk about what the tournament might have helped you do in the community?
Absolutely. So our first year, we were raising funds to actually save green space in the village. It's adjacent to one of the local parks. And actually, I think everyone in the community likely thought that that green space was part of the park and owned by the village, but it wasn't. It was privately owned. And so we raised funds to purchase that piece of land and donate it to the village to become an official extension of the park so it can never be developed. I also do want to mention, so that was our first year. Last year, we used the funds towards a project that we also coordinated with the Village of New Glarus. We built the first ever inclusive park in New Glarus, and also, it's really the first fully inclusive, and by inclusive, I mean ADA accessible park in the county. And we had to raise in total over $250,000 to help fund the project. Some of that money came from the Village of New Glarus, but then through other donations, some grants that we were able to secure, and then fundraising activities like the World Euchre Federation Championship event, we were able to raise the balance of those funds. So this year's project that we've undertaken is a dog park in our community. In addition to that, we're also looking at doing some research on pickleball courts in the village. So we did a community survey last fall and into the winter, and the results of the survey are what we use to help us drive what project we took on next.
Now, I got to ask, you're involved in this running this Euchre tournament. Do you have a history with the game yourself?
I do, yes. I have been really a lifelong euchre player. So growing up, my parents were quite a bit older, and my brothers and sisters were already out of the house. So it was just me at home with mom and dad, and they would have friends stop over to play cards all the time. They were huge euchre players. Well, they always needed a fourth person. So by the time that I was 4 years old, I could play euchre and pinochle and several other games, and I would become that fourth person in the game. So I have been playing really for my entire life and love the game.
That sounds a lot like my childhood. I remember at family gatherings, me and my cousins and some others would be playing euchre, all the way up to my dad and some of my uncles and aunts playing double pinochle. And my dad had this magical ability to count cards always. And I finally learned after years of him always knowing where the left bower was, right? There's a card that changes suit.
Yes.
So somebody calls Trump and somebody reaches in their hand and moves a card. Well, that's a tell, right?
Yes, it is. You should never do that.
Never do that. Do you have any other advice for people who haven't played euchre and they're hearing about it and wondering what the fuss is all about? Any advice on getting started with learning the game?
Oh, absolutely. I mean, if you're able to, come to New Glarus. It is a game that's really widely played here. And so you could go to any of the local establishments and you could definitely find people who would be willing to sit down and help you learn the game. You can also, again, go on our website. We have some additional information available there if you're more of a digital person. We are even looking at the possibility of having an app in the future so that people can play online together, but that's not something that we have currently.
Now, do you get to play over the course of the championship weekend, or are you too busy running the show?
I wish. No. Our board is really responsible for running the tournament. And so, no, unfortunately, that weekend, I play throughout the rest of the year. I talked to you a little bit my family history about playing euchre. We still have a monthly euchre card club night where we get together and play, and we still play at all of our family holidays. So I have lots of other opportunities throughout the year to play euchre, but definitely not during tournament weekend. It's all hands on deck. We really need a lot of volunteers to pull off this event when you're talking about having that many players there on any given day or over the weekend.
Now, if somebody's listening in another community and thinking, wow, we could use some kind of creative fundraising for our local park or whatever the case might be. Now, they can't have euchre. You've got euchre in New Glarus. But what would you suggest to them looking for creative outside-the-box thinking on, placemaking like this and creating a cool event?
Wow, that's hard. You have to really have some passion and some really dedicated people who are willing to step up and run these events. If you have that, it really depends on what it is, right, that you're looking to raise money for, and how do you motivate people to come and want to participate in that event and really want to get involved in your project. So I will tell you that, all honesty, there's another board member. He's the idea guy, and I'm the execution person, right? So I'm not the one to ask about all those great marketing ideas and how to come up with that set of it. But you tell me what you want to do, and I'll get it done.
Shelley, thank you so much for joining us today, and have a great tournament this year.
Thank you so much. Appreciate it.
Shelley Johnson is the president of the New Glarus Cares Community Foundation. She was with us for a preview of the World Euchre Championship in New Glarus. That's coming up in mid-May. Registrations are open now. And hey, if you have euchre stories to share or a euchre history of your life to share, we'd love to hear it. Email wisconsintoday@wpr.org. That's wisconsintoday@wpr.org.
WPR's one-day winter member drive is Thursday, just one action-packed day, and your gift right now will really help ensure you and your neighbors have access to independent, high-quality content on WPR. Now is a great time to give. We're looking for 600 people to get us started. When we reach that goal before the 6th, WPR programs will receive an additional $10,000 from a group of generous members. Join in now with your gift at wpr.org/donate.
Here's a question for you. Is there a piece of music that takes you back to your youth, however you want to define youth, childhood, teen years, your 20s, whatever?
Coming up this week, we have a couple of conversations where musical memories play a big role in storytelling and art. So we're looking for your songs that connect you with your younger days. You can email wisconsintoday@wpr.org or call or text us 888-642-0232. Rob, may I ask, do you have any of those
How much
songs?
time do we have, Kate? I've got ones for different years of my life. Listening to Arlo Guthrie with my dad when I was a little kid. I don't know, high school, maybe Depeche Mode would take me back, or The Clash, Portishead to my 20s. Yeah, I could go on and on all day.
Okay. We're going to stop there. We're going to hear from you. Keep sharing the songs that trigger memories for you. Again, email wisconsintoday@wpr.org or call or text us at 888-642-0232.
Wisconsin Today is the work of a team of producers, hosts, and technical directors. Learn more about us at wpr.org/Wisconsin Today. I'm Rob Farrett.
And I'm Kate Archer-Kent. You're listening to WPR News.